cloud. Yeah, thanks everyone for coming, and thank you, Professor Rasmus Birn, for agreeing to give this important, useful talk. So just a quick introduction. Dr. Rasmus Birn is an American professor, associate professor in the Department of Psychiatry and the Department of Medical Physics at the University of Wisconsin-Madison. He received his BA in physics from the University of California, Santa Cruz in '94, and his PhD in biophysics from Medical College of Wisconsin in '99. Dr. Birn's research has focused on the development of new imaging strategies and post-processing techniques to reduce artifacts resulting from task-related motion, understanding the dynamics of bold fMRI signal, and reducing the influence of physiological noise in the estimates of functional connectivity. The broad goal of his current research is to improve the accuracy, specificity, interpretability, and utility of measured fMRI signals, particularly the estimation of functional connections in the brain. More specifically, his lab is currently investigating one, the origins, characteristics, and dynamics of resting state fMRI fluctuations that form the basis for estimates of functional connectivity. Two, improvements in the estimates of functional connectivity itself. And three, the changes in functional connectivity and during typical and atypical brain development. So it's pretty clear he is the right man for the job today, talking about important QC issues in fMRI related to various sources of noise. So without further ado, thanks again, Dr. Rasmus Birn. Please take it away.
All right, thank you very much. Thanks for the great introduction. I'm just going to share my slides. All right, can people see this? Okay, great. So what I wanted to talk about was the influence of physiological noise on fMRI, and in particular on functional connectivity derived from MRI, talking about quality control, some of the latest solutions and ongoing challenges. So I'm going to, just as a brief disclaimer, I'm a consultant for NOUS Imaging, which has the firm software to monitor motion in real time. So overview of what I'll be talking about, just an intro, just a very brief comments about fMRI and quality control in fMRI, since that seems to be the theme of this set of talks. And then getting into, what are some of the sources of noise, in particular motion and physiological noise in both fMRI and resting state functional connectivity, and then looping back to talk about some of these QC metrics and issues and caveats. In the interest of time, I think I'm going to move fairly quickly through some of the background on fMRI and functional connectivity. Just for completeness, I've included those here. So functional MRI, as most of you probably know, we're not measuring the neural activity directly, but rather we're measuring the blood oxygenation and blood flow changes. So one part of the brain becomes more active, more blood flows through that part of the brain, that pushes out the deoxygenated blood. And because of the different magnetic characteristics of oxygenated and deoxygenated blood, we see changes in the MRI signal. So that's kind of illustrated here with this bilateral finger tapping task showing activation in the motor cortex. Now, these signal changes are relatively small, only a few %. And so we're also subject to various sources of noise, such as head motion, physiological noise from the heartbeat and respiration, or other scanner instabilities. So for fMRI, I would say just a few comments about quality control. I think the most important message is really look at your data, and ideally look at your data while you're still acquiring it, so that you can see if there's errors and problems and intervene right away and fix the acquisition of it. These are some extreme examples. On the left, an error in reconstruction where you see some aliasing going on, and on the right, some pretty severe distortion due to some poor shimming of this particular person's brain image. But these are the extreme examples, and looking at the images, I think it's also useful to look at the time courses. And here's an example of 9 voxel time courses from in the center voxel. You can see the fluctuations, and in red I'm indicating the kind of activation that we would expect to see. And you see also the 8 voxels surrounding this particular central voxel. And what you might notice is this big spike that occurs at a particular time point. And I like to highlight this because on the one hand, you see that perhaps there's something unusual or going on here that might indicate some problems because of this big spike. This is much more faster than we would expect to see from brain function. It's not matching this pattern that we expect to see. But also this particular display of being able to see not just the time course at the focus point, but also the surrounding time courses, I think is super helpful. This is the display that's available, say, in AFNI. Now, just want to review some of the sources of noise in fMRI and in functional connectivity. I would say the biggest source of noise, in my opinion, from functional MRI is due to head motion. And typically we see the biggest signal changes occurring at the edges. And the reason for that is that's where you see the biggest signal change. So something that was outside the brain is now inside the brain, and vice versa on the opposite side. So if this motion is correlated with the task, then we would see false positives. And that's kind of what's illustrated here on the right. We see an supposedly activation map, but you notice a lot of these signal changes occurring at the edges of the brain. And you also see this characteristic positive signal changes on one side, negative on the opposite side, indicating potential motion artifact. If the motion is not correlated with the task, this would just increase noise and you might get some false negatives. Here's just another example of some very large signal changes that you would see at the edges of the brain. Of course, the motion can be more subtle. In the example that I showed before in the time courses, this spike was actually due to a very brief movement that only occurred during one of the volumes. And so looking at the time courses can be another indicator of that. So how do we fix this? Well, typically we do image registration. That is, we pick a particular baseline image and register all of the other ones to that. That animation seems to have been changed somewhat when I went to the new aspect ratio. But the idea you can see is that we're trying to align these two images. And of course, we have to make a certain amount of decisions. Are we going to do rigid body or like 6-parameter registration or 12th parameter, allow for some shearing and distortions? What metric are we going to use to estimate the movement based on intensities or edges? And then what method are we going to use to actually realign the image? What interpolation scheme do we do? Physiological noise, the two most prominent parts of that is the heartbeat. And in this case, the pulsatile movement of the blood causes signal changes. And you'll see this particularly in more the inferior regions of the brain, like the circle of Willis, and everywhere where you have pulsatile blood vessels. Respiration can also cause signal changes. And here, the main signal change is actually the chest wall movement and changes the B0 field, magnetic field. And that actually causes a shift of the image in the phase encoding direction. So the field changes, and that can essentially lead to an apparent motion. So it's not a real movement, but it just is shifting the actual image. So generally, these physiological signal changes in most fMRI are not a huge concern unless you're imaging something closer to these pulsatile blood vessels, or depending on what parameters you've chosen, the respiration can cause some very minor signal changes. However, these kinds of signal changes are a lot more problematic for functional connectivity, like resting state functional connectivity MRI. So that's what I want to spend the bulk of my time on. Now, just as a bit of a background, functional connectivity, as probably many of you know, the idea in a typical task activation study here, we're looking at, say in this case, we have the person tapping their fingers for a period of time, alternated with not tapping their fingers, and we look for where does the signal increase during those periods and match that expected pattern. Hold on, okay. Whereas functional connectivity, we're looking at the correlation between these events. Basically, if the two parts in the brain go up and down in the signal together, we call them functionally connected. So in this particular example, not surprising, that if you ask somebody to tap the fingers on the left and right hands at the same time, then of course the activation in the left and right motor cortex are going to be correlated with one another. What is interesting is that we see the same pattern when we scan the person without the tapping fingers at rest. So if we look at the same region, say during the resting state, you can see the signal varying around. And then if we ask where else does this signal change in this pattern, here's the pattern we end up with, very similar to what we saw previously. And you can see overlapping the two, some correlation between them. So the idea here is that in addition to task-related neural activity, we have spontaneous neural activity that is transferred through the same hemodynamics and showing up in our MRI signals from this. So this was first shown by Bharat Biswal in 1995. I'm just going to go quickly through this because I think a lot of you would know this already. It's a very well cited study. On the left, you see the activation from a finger tapping task, and on the right, you see the functional connectivity at rest, showing a striking correlation. And there's a lot of really good work done in the early years. And I should mention these are correlations that happen at relatively low temporal frequencies, usually between 0.01 and 0.1 hertz. And there's a lot of really great work that was done earlier on to really establish that these fluctuations truly are neuronal in origin, that there is a neuronal component to these fluctuations, and that they really are reflecting something functional in this. Of course, the problem with this is that because we're defining functional connectivity as the correlation between time series, and as if two parts of the brain go up and down together, we call them functionally connected. There's a lot of other reasons why the signals could be correlated or functionally connected. Could be physiological noise, head motion, and all these other sources of noise. So one big source of noise in resting state connectivity, as it was for regular connectivity, is head movement. Now, we've known for years that head motion is an issue with fMRI. And even the earlier studies in functional connectivity tried to do steps to mitigate the motion. The challenge, though, and this is a set of 3 studies that came out in about 2012 that really highlighted how problematic motion is for resting state functional connectivity. On the left, you see a study from Koen and Van Dijk, where he shows the temporal signal to noise versus the amount of movement. And not surprisingly, if the person's head moves more, we see lower signal to noise. But look at the scale on this axis. That is movements of 0.02 to 0.1 millimeters. This is, of course, on average across the run. But we're talking very small amounts of movement can cause substantial differences in this temporal SNR. The second study was one from Jonathan Power and colleagues. And what is shown here are the differences in what are called scrub, that is when you're censoring out high motion time points versus when you don't censor them out. And you find that you see better connectivity of the default mode network when you censor out the high motion time points. But importantly, also, there was a distance dependence of this difference with and without motion censoring, or the scrubbing as they call it, such that short range connections tended to be decreased by this censoring compared to long range connections. Or flipping that around, basically what it's saying is that the movement is reducing long range connectivity, but increasing short range connectivity. And this was particularly problematic to researchers at this time, because one of the most prominent findings about brain development was that as the brain develops, you see an increase in these long range connections and a decrease in the short range connections. But the problem being that, well, maybe everything we're looking at is just the fact that kids move more in the scanner, right? Because there seems a similar pattern. And this similar distance dependence was also shown by Satterthwaite and colleague. So in addition to motion, we also have physiological noise. And by the way, if you have questions, I'm seeing there's some questions popping up in the chat. I'm going to find it hard to monitor both the chat and the my slides. So if you feel free to interrupt me if there's something urgent, otherwise we can just do a discussion at the end about that. Does that work? Okay. So again, these are the sources of noise from physiology that I mentioned before. Can also cause problems in terms of functional connectivity. But there's another source of noise that I think is even more problematic than those two, the respiration and the cardiac, and that is that changes in the breathing patterns, that is, the changes in the depth of breathing, can also cause profound changes. And this was first shown in, or at least brought to my attention in the MRI and functional MRI field by Richard Wise back in 2004. And what you see here is a map of the changes in the signal intensity correlated with end-tidal CO2 just during normal rest. And you can see that the person's breathing varies. It's not perfectly steady. You see variations in the CO2. And because CO2 is a very potent vasodilator, if you say hold your breath, CO2 builds up and the blood flow increases everywhere in the brain, or particularly in the gray matter regions of the brain. And so you can see the striking correlations in the signal intensity over time, averaged over, in this case, white matter and gray matter with the end-tidal CO2. You can also get an estimate of that just looking, in this case, at the envelope of the respiration pattern, which I call sort of the respiration volume per time. You can map very similar signal changes that are related to these breath-to-breath changes in respiration. So just as a bit of more of a background, the way I got into this was actually that I had a student at the time who was very interested in studying functional connectivity, in particular functional connectivity of the default mode network. Default mode network, as you might know, this term was first coined by Mark Rakel, where he noticed that there was a set of areas that consistently showed decreases in activity when the person was engaged in a cognitively demanding task. So the idea being that these areas are more active at quote unquote rest when the person is not engaged in a cognitively demanding task, and therefore constitutes a default mode. And the student that I had at the time was also interested to see and follow up some of the studies by, for example, Mike Gracious, who showed that not only do these areas deactivate during tasks and are more active at rest, but they are correlated in their activity at rest. So this is showing the functional connectivity of this default mode network at rest. So the student that I had was interested in knowing, is there a difference between the deactivations during a task and the functional connectivity at rest? And so we set up an experiment where we had a lexical decision-making task, and you can see the default mode network areas are in blue, showing the deactivations. And then he looked at the resting state connectivity with a receive region and a posterior cingulate, and here's the connectivity you end up with. And we did notice that there were some areas here, extending maybe further down here, maybe in a visual cortex or sort of occipital lobe, that showed strong connectivity with the posterior cingulate, but not really deactivations. However, at the same time, I was looking at the signal changes from related to respiration, because I'd heard the talk from Richard Wise. This is so I calculated the same map. This is the map I ended up with on the left. So you can see a striking correlation between the respiration related changes and the quote unquote connectivity of the posterior cingulate. This was sort of a serendipitous moment that I had just created this map and had that on my screen, and I walked over to my student's cubicle and I saw the same map on his screen, except he was looking at connectivity. So what this made us think is that perhaps the regions that were outside of the classical default mode network areas that we were seeing were perhaps not extra activations or connectivity regions, but rather maybe influences of the respiration or respiration volume per time changes. There's also effects of heart rate. You can see changes in heart rate also correlating across the brain, and particularly in gray matter. And I think the next lecture that you have from Jean Chen might get into more of these changes. So how do we correct for this? Here's just an example sort of flowchart of the various processing steps that are available for correcting for these kinds of distortions. I'm not going to go through each of these steps, but I'm going to highlight a couple of key points. Slice timing or physiological noise correction and some of the nuisance regression. I saw a brief chat there about sort of the, which do you do first, slice timing, physio corrections, motion correction. There's really there's sort of problems with any order of them, right? Because in some sense, we want to do, if we do slice timing corrections before physiological noise correction, well, now you're interpolating across time. So we've got, that's not going to work if you have physiological noise. But if you don't do the slice timing correction, well, you have to account for that when you're doing the physiological noise correction. And I had actually a study, and I can get in more to that in some of the discussion later on, where we looked to combine motion correction with physiological noise correction. The interesting finding there being that it really, we found, didn't seem to make a lot of difference. It was one of those studies where it worked great in theory, but it didn't work great in practice. So I'm happy to talk more about that. So here's just a list that I've been sort of adding to over the years of the different physiological noise correction tools. I must say I love the acronyms people come up with, especially sort of apple core and pear core. You know, if we can come up with an orange core, we can compare apples and oranges. But anyway, or the fMRI's ICA-based X noisifier or fix. So a couple of them. One just for sort of completeness sake, you know, the simplest method we can perhaps do is just filter out, right? We can apply a notch filter and filter out the frequencies we don't care about. The question is, can this filtering really help us, let's say specifically filtering out cardiac noise? And the answer is yes, but only if the data are sampled fast enough. That is, if your TR is less than 1/2 times heart rate. So here's an example of that with cardiac fluctuation, let's say being on an average human of like 1.1 hertz. And here's that mapped out in frequency. Now, what happens when we sample this at a more typical TR of like 2 seconds, which was quite common? What happens there is that in blue, you can see the data sampled every 2 seconds. But if we connect those look like a lower frequency. And what's happened is that because we're not sampling the data fast enough, that is, we're not sampling it at the Nyquist frequency, the fluctuations get aliased to a lower frequency. So it actually appears as a lower frequency. And therefore, if we filter this and get rid of high frequency signals, we're not getting rid of the cardiac noise. So this really only works if our data is sampled fast enough. For most of the imaging, when we're doing even at 800 millisecond TR, like the Human Connectome project, it's not sampling the data fast enough to correct for the cardiac noise. One technique that does work really well that I found for this kind of physiological noise correction, particularly for the heartbeat and for the actual breathing patterns, is what's called retro-ICOR. And the basic idea here is that we find out the phase of the cardiac cycle and the phase of the respiratory cycle that each image was acquired in. Then we create sines and cosines of those phases or multiples of those phases. And we use these as additional regressors and remove them or project them out of our data. Conceptually, this is the same as, let's say, if you look just say at the cardiac, you know, reshuffling the data based on the cardiac phase that it was acquired in. So this is what I'm showing here, and then fitting a lower order sinusoid to this particular waveform and then regressing that out or removing those fluctuations. And that actually tends to work quite well, I found. But it does require that you have a measure, an independent measure of the heartbeat and the respiration. For the respiration volume per time changes, the RVT core, here's an example of that. If we take the estimated or measured respiration volume per time, convolve this with some respiration response function and regress it out, it does clean up the data some, but in practice, I found it really doesn't clean up all of the areas as well as we would expect. Part of that is that because the respiration response function, that is, what is the response to, like if we were to just do a simple linear convolution from a sort of engineering standpoint, that this response function actually varies across the brain. So what I'm showing here is actually shifting this respiration response function forwards and backwards in time and finding out where do we get the optimal shift. And you can see that varies across the brain. And if we allow for this variation, we can actually get much better, account for much more of the fluctuations, much more of the noise. Other groups have extended this even further and have created subject-specific estimates of the respiration response function. And I've also found that that makes a big difference, that accounting for that variability between subjects can help modeling for more of the noise. What I found actually works the best for removing for some of these signal changes are not necessarily using the estimates of the respiration volume time changes, but rather getting some estimates of noise from the data itself. So typically we include the motion realignment parameters, and the most typical ones that I've seen is either 12 parameter, that is the 6 realignment parameters and their derivatives, or perhaps the square, including also the square of these for a total of 24 parameters. But then also to model other fluctuations like the respiration volume per time changes is averaging the signal with the white matter, CF, and global signals, and maybe including the derivatives of those. Other signals would be perhaps local white matter changes or principal components of the white matter and CSF rather than just the average of those. The idea behind these is that generally the signal changes that we care about for functional MRI happen in gray matter. And so things that happen in white matter or CSF, like in the ventricles or globally throughout the whole brain, are perhaps more indicative of noise. One of the steps that's been perhaps more controversial is this global signal regression step. And you can see on the left here as a connectivity map of the default mode network without or with global signal regression. And you can see it does help sort of delineate the regions of the default mode networks, or the areas we expect to be connected. Whereas before we saw pretty high correlation throughout all of gray matter. And this was actually one of the steps that was done by Mike Gracious' original paper, where they were looking at the connectivity of the default mode network. But we've also shown that this global signal is highly correlated with the respiration volume per time changes, perhaps not surprisingly, because they do occur sort of more globally throughout the brain. The problem with regressing this out and why it's been so controversial is that by definition, the global signal also contains the signals of interest. It contains pretty much everything in the brain. What's been shown earlier is that some of the deactivations, or I should say negative correlations that have been shown before between, say, the task negative or default mode network areas and other regions like the task positive areas are really only seen when you do this global signal regression step, not when you do it. So it can change maps of functional connectivity. And also there's been some simulations showing that it can potentially change group maps of functional connectivity. So because of that, a lot of groups are going more towards not including the whole brain mask, but rather just the white matter and ventricles as nuisance regressors. Again, I think this is, one group of researchers would still argue that this is not as good as removing sources of noise, and that you really should be including global signal because it's much more effective at reducing noise, whereas others say, well, you could be throwing away true signal. Maybe another way to reframe this debate is to try to figure out, okay, the global signal, is that reflecting mostly noise that we want to get rid of, or is it reflecting true signal to the extent that if we were to remove it, it would distort whatever estimates we're actually interested in. Maybe we can have a debate about what is the global signal, and is this stuff we care about, or is this stuff we don't care about and we can regress out. So here's just an example. If you just regress out those CSF and white matter signal changes, you can see that these maps do become a lot more focal, and we get a much better, cleaner map from this. So a couple more steps. Censoring is another post-processing step that I mentioned before, that is removing frame time points with high movement. And there's sort of two ways of doing that. One is you could just throw away the data and then go with the rest. The other is actually you can create a spike for each time point censored and include these as additional nuisance regressors. This would actually allow you to sort of combine some of these nuisance regression steps and some of the temporal filtering as well. A couple of other studies I just wanted to highlight, since they came from my group and I've been very interested in improving motion correction, is that we can also get great estimates of additional, if you will, regressors to reduce movement from edge voxels, because that's where we see the biggest signal changes. And the reason why this can sometimes be really helpful is because if the motion occurs very briefly, it may only affect a few slices. And so it might not appear in the image realignment parameters, whereas it does still appear in the data itself. The other is that it occurred to me that just including the motion realignment parameters as nuisance regressors makes the assumption that there's a linear relationship between the noise, the nuisance, motion-induced signal changes and the actual movement. And that's not necessarily always the case. For example, if you think of sort of an edge at a point, shifts in one direction may not produce the exact opposite signal change as shifts in the opposite direction. And so we can actually come up with a better estimate of what the signal changes would look like from the movement, sort of simulating what signal changes does this particular motion induce, and create regressors based off of that. And as you can see here, in the red is the estimated movement from our simulated motion, where compared to just the 6 realignment parameters and their derivatives, and you can see a much better fit with those kinds of fluctuations. And there's additional techniques that are basically using data-driven approaches to correct for the data. And I don't have time to go into all of these. One of the challenges that I've been involved in more recently is trying to collect data from infants And the problem, of course, is that infants, we're scanning them typically during non-sedated sleep, and they can move more. So here's an example where the type of movement that we often saw. So this is a study that I've been involved in where we collected data from about 150 infants at 1 month and at 24 months of age. And so I would say about 75% of the infants showed this particular characteristic movement, where they would be perfectly still for a period of time. And then there would be a large head movement, anywhere from a few millimeters to upwards of, say, 20 millimeters or 20-degree rotation. And then they're fine again. So they're just rolled over in their sleep. The problem with that is that even if you realign data, the data aligns pretty well, but because of that rotation or translation, the image has moved into a different part of the RF coil sensitivity profile. When you realign it, you still get a signal change, as you can see here in the time course. So that's still going to cause problems in the functional connectivity. So we've come up with sort of an additional approach that can help with this, what we call jump core. That is, we determine when these jumps occur and then try to regress them out in a very similar way as you would say, try to combine data from multiple runs that were acquired where somebody might have moved between the runs. You essentially are also estimating the jumps between the potential signal changes between those runs. So now getting into some of the more interesting, the QC metrics and issues. So what are some of the metrics that people have used to measure quality? So this is the overview. I'm going to get into some of these here. So we've already covered the visualization. The challenge, of course, is that, it's great to say we're going to look at the data and really we want to be very close to the data. But when you get to sizes of studies like the Human Connectome Project, or let's say the ABCD study, where we're looking at 12,000 subjects, visually inspecting each one of those to try to understand what's going on is incredibly time consuming. So we want to come up with some measures that can summarize this. So some ways we can summarize this is the temporal signal to noise ratio. This is sort of an example here at the top, a typical SNR, and at the bottom one where there was a problem with the RF coil, and one of the coil elements was actually going in and out, and you can see the decreased signal to noise as a result of that. I will say, in my experience, the TSNR maps are really great for catching very gross problems like this, but they're not often very good at capturing very subtle differences that might occur more on the voxelized level. Another kind of plot is these gray plots. That's another way to visualize the data, and that is if you just plot the time along the x-axis versus all the voxels, and it allows you. We as humans are really great to sort of integrate this information. You can sort of see signal changes that tend to be very global. And in this case, it happens to coincide with head movement. And you can also see that there's actually a decrease in the signal that is occurring after the head movement in some of these cases. Potentially some physiological fluctuations that occur coincident with the movement. Frame-wise displacement is another way that people use to as a quality metric of how much movement there is, just to make you aware that there are two different definitions of this, either combining the absolute value or doing the Euclidean norm of the frame-wise differences from one time point to the next. And then there's another measure called DVARS, that is it's a temporal derivative, then RMS variance over elements. So basically you take two images, take the difference of them, so you get a difference map over space, and then you calculate the square root of that. And so you get a map of those differences, and you can integrate over space to get a measure of it. Another measure that I've seen used quite frequently is this QCFC, or that is it's the correlation between your quality control metric, like the mean frame-wise displacement, and the functional connectivity. And that's kind of, you can see here is a connectivity matrix, and you can see in colors on top of this is the correlation between the connectivity and the mean frame-wise displacement across subjects. Another metric that's been used to estimate, and you can see here, the idea being that without censoring, you have this general strong correlation, but with censoring, it shifts that distribution to be more centered around 0. There's this distance dependence that I mentioned. So again, we don't want this distance dependence here. So you can see with censoring, you eliminate that distance dependence. Couple other metrics that I've seen are network identifiability, that is how easily are we able to identify and distinguish separate networks based on different processing that we do, or also prediction or classification, what is best, what processing steps are best in order to correlate the functional connectivity with something else like behavior or classifying different participants.
Sorry to interrupt, Rasmus. Can you go back? It seems like this distance dependence is an important relationship. Can you briefly motivate the importance? Where does it come from? Is there basis to believe there should not be distance dependence? Especially from a neurobiological perspective.
Right. So I guess first of all, I should say the sort of what's plotted here on the y-axis, right? So the QCFC, which is the same as what's shown here on the left, is, in a way you're thinking, it's the correlation between, say, the amount of movement and the functional connectivity. Another way to conceptualize that, it's essentially seeing, is there a difference between high moving and low moving subjects? And you could say that, well, maybe there's nothing, we wouldn't necessarily expect there to be anything different about people who move more versus less in the scanner. Let's say we're all drawn from the same population. So we don't expect to see a difference. We expect that to be close to zero. Now, extending that with a distance dependence, it's saying that for certain range connections, there's a difference between high moving and low moving subjects versus others. So we're really expecting, the assumption in some sense is that there shouldn't be any difference between high and low moving subjects, regardless of short range or long range connections that you see here. I think what's happening here, and this is something that maybe you have to also keep in mind, is one possibility here is that why we're seeing this distance dependence is that most of the head movement tends to be head nodding movements, because it's really easy to constrain the head when you're in a scanner from, like if you're in a supine position, from rotating around or doing this sort of yaw, but it's very difficult to keep it from nodding or rotating around that right-left axis. And because of that, because generally the distances are shorter in the right-left axis than the anterior-posterior axis, this would increase connections because it shows very similar signal changes in the left-right symmetry, but the opposite signal changes anterior-posterior. So that will cause a decrease in the connectivity. So the basically long-range connections tend to be decreased, and short-range left-right connections tend to be increased. So this is another what could be explaining this. Does that make sense? So, and you bring up some interesting points here. Actually, this leads into this. Is that it's been shown that, for example, in Satterthwaite in 2013, that global signal regression actually increases the distance dependence of this. And you might think, just conclude from that is, well, we don't want a distance dependence, so we shouldn't be doing global signal regression. But it turns out that the reason for this is that global signal regression is differently effective at denoising long versus short range connections. So it's really great at, say, removing I think the changes from the short range connections, but not the long range connections. And because of that, it is actually now introducing more of a distance dependence from that. It might actually be the opposite. I have to see, yeah. The other ones, these are points that I've thought about a lot, is first of all, this metric of QCFC, of basically the correlation between the mean amount of motion and the functional connectivity across subjects, assumes that the motion results in very similar signal changes or similar changes in functional connectivity across subjects. For example, if you have more movement, you see greater increase in functional connectivity, right? But when I was looking at our infant data, the issues there was that because the infants were moving in just, not always in the same direction, the signal changes were, in one subject might show an increase, in another subject it might show a decrease. And so it really was more of like a broadening of that distribution. So one way solution to that is instead of just calculating the correlation between functional connectivity and the mean amount of motion, I looked at the absolute, essentially, the absolute value of the functional connectivity compared to the amount of movement. So to try to get any increase in connectivity or greater negative connectivity to show up as an increase. The other thing to keep in mind is that this is just looking at the correlation between connectivity and motion. Just reducing the correlation with motion doesn't imply that we have improved image quality. So I could take the set of data, add a whole bunch of noise to it, and I would reduce the correlation with motion. But that's clearly not making the data better, right? So there's a limitation here in this particular QC metric. And the final one is that sort of inherent assumption that we're assuming that there's no significant difference between the high movers and the low movers. And the study from Siegel et al. Actually showed that there are potentially trait-like differences in individuals who move more in their MRI scanner. And those could be reflected in true differences in how the brain is wired and how the brain is functionally connected. Another caveat or another thing to be aware of is that the head motion changes can be coupled with respiration changes. So we can see a correlation between motion and respiration, as what I've illustrated here before. Also there's a coupling between those in the sense that our frame-wise displacement measures that we're using for the censoring, for example, can be affected by the respiration. And this really wasn't noticed clearly initially until some of the data that came out from the Human Connectome Project and the ABCD study, which had much shorter TRs. And in fact, in that TR, they could really more accurately see the signal changes that are coming from the respiration. And because of that sort of false motion, shifting in a phase encoding directions, apparent motion, it was actually appearing like it was sort of coming into the frame-wise displacement. So it is a movement of that image, but because it is a pure translation in the phase encoding direction, it's actually really easy to correct for. There's no spin history effect or anything like that. But if you don't account for this, you can end up throwing away a lot of data. In some cases, more like say 2/3 of your data would have to be ignored because it looks like there's a whole bunch of motion, but it's actually very correctable motion. And then finally, looking at one other issue is the degrees of freedom. Things to keep in mind is that the censoring, depending on what your threshold is, and bandpass filtering can significantly reduce the degrees of freedom. So acquiring lots of data is really best, having lots of long time series or very short TR. However, that's not always practical if you're dealing with patients or pediatric subjects. And so since there is increasing evidence that there is also some perhaps signals at higher temporal frequencies, maybe we want to revisit this sort of whether or not we do bandpass filtering, because it does greatly reduce the degrees of freedom. So just in conclusion, wrapping it up, I hope I've shown you that motion and physiological noise are significant sources of noise and should be corrected. Look at your data, evaluate the QC metrics, but also be aware of some of the limitations of these QC metrics. So thank you.
Any questions from the audience?
I found myself twitching a couple of times with your phrasing about correcting, that we're going to correct for the motion and respiration and clean up all of the effects. I tend to use phrases more like compensate or mitigate or be aware of. Do you think it's actually possible to correct for some of this stuff as opposed to minimizing or mitigating type effects?
Yeah, I should have been more careful in my phrasing, I guess. I think the maybe more correct way is to say, well, we want to reduce the effects of movement and reduce effects of physiology. My experience has been, because these are so complicated and there's so many different sources of noise on there, it's going to be, well, I would say impossible to get rid of all sources of noise, right? Without also getting rid of all the signal. So, but we can certainly try to reduce it as much as possible.
Yeah, I guess I was kind of giving you a hard time because of that, but I think it is common in the fields, especially perhaps in resting state or connectivity type stuff, but maybe throughout, to talk about correcting for these things. And I'm not so convinced that something like respiration effects, even in task data, can be corrected for as opposed to understood because of things like entrainment and just all the insidious ways that respiration can change the brain change different parts of the brain in different ways.
Exactly, and not just the artifacts, but also the real sort of neuronal changes associated with differences in respiration.
Yeah.
Just as a quick interesting aside, we had one paper actually on this where we were looking at task correlated breathing. And the initial thought was that if we look at subjects where their breathing was correlated with the task, we'd see all sorts of noise in our activation maps. And then by reducing that, we'd get much better activation maps compared to those that didn't have it. It turned out to be the exact opposite, because what was happening is that those individuals who had the task correlated breathing were the ones who were really paying attention to the task and had much better activation patterns. Whereas the other ones who didn't have the correlated breathing, it's not that they weren't varying their breathing around. It was still varying just as much. It just was they were bored and not paying attention to the task, and their activation map actually looked a lot worse. So
yeah, did you publish that? Because
yeah,
which one is?
I'd have to look up which one that is, but I think it was in 2008 or so. I think we called it something about task correlated breathing changes.
Yeah, but I mean I guess that's what I meant by entrainment, because that's been seen a lot in psychophys literature, and we see it in our data as well. I haven't done a super solid check of performance against the degree of entrainment, but it definitely varies and it definitely occurs.
Right. And
yeah.
That's another consideration to keep in mind when we want to say regress out respiration and volume changes. And I'd say even considering heart rate changes, which some people have also said, well, maybe that's just noise, we want to remove it. But of course, we know heart rate changes are closely tied to brain activity changes.
Yeah, yeah.
But maybe on a more optimistic note, you could say there's different effects, right? The ones that really are neuronally driven, and there I totally agree with all that was said. But for the examples you showed, for example, respiratory motion, so real motion correlated with breathing, or apparent motion with respect to the changes of the field, that's something where we could have independent measures outside the brain, right? We could do prospective motion correction. We could basically, or at least prospective motion detection. We could have sensors to see, right? Do people move? Does their head move? And we can have field sensors, like magnetic field probes, for example, that would allow to measure magnetic field changes up to a certain order, right? So phase apparent motion and phase encoding direction doesn't have to be in the mix, and actually rigid body motion also doesn't have to be in that mix. So we could correct parts of the
exactly. I mean, there are of course challenges in trying to estimate the movement in real time. There's navigator echoes work with a certain delay. There's marker systems, but then you have to go to worry about, if you put them just on the skin, is the skin moving because the person is frowning and changing the concentration? And my, in talking with a lot of colleagues, is that they actually find that is more of a problem than the head movement initially. So I think there are advances coming along those lines, that with camera systems to try to better estimate head movement, but it's still a challenge. And then also just, the fact of if you're moving in a magnetic field, if your movement is large enough, you're actually going to be changing the angle with respect to the B0 and changing the amount of signal dropout that you get in different parts of the field. So, I mean, if you had an estimate of the amount of movement, you can try to correct for or reduce that as well, right? I mean, in some senses, like we understand the physics of everything that's involved here, right? But it's all of these together that it makes it very a complex system.
I think we understand the physics better than the brain, and that's why I was thinking we could maybe ramp up the signal modeling, and then only have to deal with the brain, and exactly how you just
yeah.
So do you think that the apparent motion from breathing is that well understood now? I mean, like, could you predict from the size of somebody's lung capacity, or what is the critical measure for predicting? Because it seems obvious that some people have much stronger apparent motion than others.
Yeah, I think, right. I think a large part of that is, exactly how it's sort of more like the body shape and size as well. Than the amount of lung volume, like how much change are you going to get? So if you have individuals that are larger in the MRI scanner, you're going to see more of that modulation than if they're like, say, a smaller or a pediatric patient, things like that.
I've done I wonder about that. I mean, have you actually, because I've tried to do a bit of predicting just with fun of like correlating BMI or height or stuff like that with apparent motion or not. And
I have to look, it's a good point. I have to look at that. I have looked at the correlation between BMI and actual motion, and there is a strong correlation there. But I think that's largely because the individuals we were studying, were sort of broad spectrum. And I think there was a lot of people who were very uncomfortable in the scanner because they're squeezed very tightly in there.
I guess it's hard to model in advance, right? I mean, basically, it really depends on the body shape. But for this particular case, you do have the means in the scanner to measure the magnetic field. Like you can either use navigators or you can use external field probes, basically. So there's a way to measure it. It's just external hardware. So it's not a principal problem, but I guess predicting it from the shape, I think, chest volume, right? And how people breathe also, right? Some people breathe in their stomach, some people breathe in their chest. So that's hard to predict.
I mean, one easy way, conceptually easy way to do it is if we just keep the phase information along with the magnitude information. There we can very clearly see phase changes that really shouldn't be there for typical activation, but are just related to the actual magnetic field changes. Unfortunately, most scanner manufacturers don't by default output the complex data. And in some cases, they even do some post-processing after it's been a complex signals, so it makes it a bit more challenging.
Hi, Rasmus, a fantastic talk. I loved your full overview of all the noise sources and all the possible ways of correcting noise. That it's still up in the air what's the best way, and I don't think we're actually going to get anywhere close in the meantime of correcting a proper way of correcting. It just depends on what you want, what's your end goal. On that note, actually Paul is here in the call as well. We've been working specifically with HCP data and also the NKI Rockland sample data on trying to really deal with this respiration artifact data. And we basically are trying kind of like a throw everything at the wall approach, and we're pre-processing the data through several different ways. Like we're forking it using RVT and RetroICore. We're using global signal regression. We're even applying ComCore and also notch filtering developed by Damien. And so if later, can we set up a call? We would love to show you this data and see where we're getting if you recommend us to go any other path. Yeah, I'll shoot you an email later, and it's kind of, so Paul can give you a presentation, and it's currently a work in progress that we're getting there.
Yeah, no, I'd love to talk more about this.
Oh no, yeah, we would love to see, because we're really focusing on one of the end metrics that we're looking at is test-retest reliability, and so trying which of these pre-processes are increasing ICC results and also discriminability. So
I would say the one caveat, and I didn't present this here, partly due to lack of time, also because I think the next talk from Jean Chen might get into this. One of the challenges with test-retest reliability, which is what we found, is that when we looked at all sorts of corrections and looked at test-retest reliability, pretty much every correction we threw at the data reduced test-retest reliability. And the reason for that is that the noise is highly repeatable. And so what happens is, if you look at this, it is actually reducing within subject variance from session to session, but it's even more so reducing between subject variance.
We have exactly those graphs to show you.
Yeah.
We have
exactly. And so what I think is going on is that it's reducing some of the spurious noise that are causing differences between individuals. So it's reducing, strictly speaking, test-retest reliability, but I would argue perhaps increasing validity because it's making it more.
Exactly. Yeah, no, that's exactly what I want to share. And just for a concept of time, I want to ask you then now a real question that the group might be interested. What's your opinion about multi-echo fMRI and how it's kind of been proposed to actually to mitigate a little bit more of respiration artifacts, especially like deep breaths and things like that?
No, I think it has a lot of potential. I'd love to, I've been talking with GE to see whether we can get the multi-echo sequence running here. They have it version, we just have to do all the paperwork for it. So I think it has tremendous potential. And the other benefit to it too is that, you know, typically you get a very short echo time together with the typical echo time, and it's really works very well together with some of the simultaneous multi-slice imaging, because now you've got that extra time to work with.
Yeah, it's exactly. Yeah, we're working right now for we're revamping the Rockland sample too, and we are going to begin collecting multi-echo, multi-slice data.
Right, and so the cool thing about having the really short echo time is, even regardless of this kind of denoising approach, the multi-echo denoising, just being able to take that short echo image and combine them in an optimal fashion, or even just combining the images, you actually get much better signal in like orbital frontal cortex, temporal lobe, because those are areas where you typically have signal dropout and also really short T2 stars. So, you know, a shorter echo time is more optimal for those regions.
Oh, fantastic. That's great. Thank you.
Do you need to run away, Rasmus, or do you have
Yeah,
some
I'm just
more
going to
time?
send them a quick email saying I'm going to be a couple of minutes late, but.
Okay.
No, I actually had to head out. Thank you very much, you guys.
Yeah, no
Thank
problem.
you. I'll shoot you an email later, Rasmus. Thank you.
So one question I have for you and everybody here, you know, it sounds like we don't have a good ground truth. You know, you're like, I think Joe raised it in a different manner. You know, you corrected, but how do you know you actually corrected it, right? Given all sorts of unobserved confounds and various other things, you know. So, like, has there not been any? Oh, hi! I didn't know Chris was here. Hi, Chris. No problem. So, has there been any effort using phantom data and any other more ground truth methods, so to say, to validate the correction methods themselves, or at least to some kind of interpret them in a better way? Yeah,
so the one study I'm aware of is the one that one of my students did at sort of one of my ideas that I had, and we still have to write that up actually, but it's so basically looking at task data. So in this case, we had a motor visual task. So we basically showed somebody flashing lights and had to do a very simple finger tapping task, but we varied the timing such that if you look at different windows of time, you've got different correlations between the motor, the finger tapping, and the visual activation, right? So the idea initially was we'd have separate runs with different correlations, but you could just look at different windows within a very long run for that. And so we can sort of see what kind of connectivity, you know, the correlation, if you will, do we expect to get for the different time windows versus what do we actually get? And you can incorporate things like, you know, we can actually estimate per voxel and per subject impulse response function, you know, because it's an event related design. So we can estimate that, we can incorporate that, so we get a much better estimate of what the actual activation is within those voxels and what the connectivity should be. And in general, what we find is that these correction methods, none of them actually make the connectivity like to be exactly what we would expect it to be, but it is across subjects really reducing the variance and making the subjects more like one another. And in particular, it's the data-driven ones like the white matter and CSF regression that tend to have the biggest influence, what we said. You know, of course, it's making assumptions about, you know, that they're, you know, there could still be modulations in attention of how they're paying attention to the visual stimulus and how they're performing the task, things like that.
That was actually relating to one question I had during your talk when you said that basically the RI-wise regressions tend to work better than the model-based approaches, and I was wondering what was the metric, or how do you say it? So that's related to that, or is there any other?
It's related to that, but also just, I guess it's the you know, sort of seeing what kind of steps get us, I guess I should say, maybe reduce variance between subjects, but it's also more of like it's getting us maps that are closer to what we would expect to see, like the default mode area. So for example, the connected areas are more like the areas that are deactivated. But you know, I hesitate because we have to be cautious because as I think in one of the first resting state conferences, there was a lot of debate about global signal regression. And at one point, I think Vince Calhoun stopped and said, wait, hold on. They're arguing that you should do global signal regression, which potentially removes signals of interest, but yet you should do this because it's making the maps look more like what we'd expect to see. So basically, we should be doing something we know to be wrong to reinforce our priors, right?
Yeah.
which is like, well, yeah, but is this really a right measure of good? You know, it's the ground truth. You know, what is the ground truth?
Exactly. That's my question. You know, can we develop some ground truth? You know.
Yeah, but if you stick with more straight, finger tapping, like he was saying, but instead of trying to do connectivity style analyses, if you just do you have more bold here when you're doing finger tapping than when you're not? You know, can you see the pattern in, motor areas? That I think everybody can agree is pretty much unequivocal, that if you're seeing that, it is sensible. I mean, it requires, but it's if we can't trust motor activation going with finger tapping, I think we're really in trouble as far as priors go.
Right. I mean, then the other direction, just to point out, I have to run, but it's, it also depends on what is our ultimate goal, right? Because if we're truly trying to understand what a connectivity map looks like, or activation map, then yes, these are important questions. But if our main goal is to try to have some metric that has the best prediction of outcome to a particular therapy or to a particular intervention, then just in the same sense that we don't fully understand all the nuances of bold, but we do know that it highly correlates with neural coupling. If we know that this particular measure really predicts outcome really well, then okay, maybe it's throwing a bit of noise in or a bit of motion, but it works, right? All right.
Any other questions? Yeah, this was fantastic talk. Rasmus, thank you for joining and allowing us to record it. So I don't know if you guys saw the screen I shared in terms of a little, I'll try to share that again quickly. I was wondering if you want to comment on this. Basically, this touches upon, again, these unobserved confounding issues that we were talking about. Basically, this is a nice review paper by Thomas Liu on an overview of noise contribution to the fMRI signal. He'll be giving a talk later, but because we were discussing all these today, I thought basically one important point he makes is that brain is actually a source of both signal and noise. So how do you deal with this? Do you think it's an important problem? And like he's trying to say, the boundary between signal and noise is actually not clear sometimes. Like you're right that our goal matters in terms of what we are trying to achieve and whatnot, but from a pure a scientific correction point of view, in terms of modeling things right and getting the signal right correctly, and the brain being the source of both signal and noise, how do we go forward with that?
Exactly. And one person's noise is another person's signal, right?
Yes. Yes. So do you think that's a problem, or should we, what can we do about it?
I think, I guess doing two prongs. I mean, one is really trying to understand the contributions of these fluctuations more and how they affect the signal. But at the same time, going ahead and seeing what can we do to improve, correlations with behavior and understanding that aspect of things. Because, I've spent so much of my time trying to improve things on the signal, and sometimes people just bypass, ignore that whole issue and find some really cool findings, that in the end, when you do all the corrections, still remain the same, right? So I think we have to operate both, not let ourselves be slowed down too much by just focusing on the noise, but of course, try to understand it better, but also work towards what our ultimate questions are.
Great. Thank you so much. If there are no further questions, I guess we'll stop it here. Thanks again. It's been very helpful.
Great.
Thank you everyone for joining.
Thank you.
Yeah.